Hi everyone, Dr. Daniel Chanchef here from Green Square Health. As you may have noticed, it's been a little bit hazy in Sydney the last couple of weeks. 2 weeks ago, it looked like we were in an apocalyptic sort of fog land. And for people who suffer from asthma, we kind of knew that was happening maybe the day before it actually happened, because a lot of people would have had wheezing through the night, a lot of difficulty sleeping, and maybe had to use their inhalers. But with the catastrophic fire warnings coming across New South Wales, I think it's going to get a little bit worse this week as well. So even though we're protected in Sydney and central Sydney from the fires, a lot of people are going to wake up with a lot worse symptoms in terms of their asthma. So you might experience some coughing, some shortness of breath, some wheezing, and some general tiredness. And if that's the case, then we want to make sure that you're getting your asthma well controlled. Now, if you already use a reliever inhaler, something like a Ventolin or an Asthmol inhaler, it's good to make sure you've got 1 or 2 of these on hand. Something in your work bag and something at home by your bedside table, by your bathroom that you can use. It's really important to use these with a spacer. Now, I know these can be a little bit inconvenient at times. This is a very big spacer because we can sterilize these ones, but they do make them in a much smaller package now, and it results in a much higher dosage of the medication reaching your lungs, which means you can use many less puffs of the inhaler and have a much better impact of how effective it is at opening your lungs up. For people that are noticing that they're using their inhaler a lot more frequently, it might be time to get back onto your preventer, or if you're already on a preventer, to increase the dosage of that. Now, if you've seen your doctor about this in the last little while, you should have an asthma action plan that tells you exactly what to do if things are getting worse. If you don't have one of these, make an appointment with your doctor and have a look at how we can manage your symptoms, because it's going to be a long, dry summer, and there's probably going to be a lot more bushfires this year as well. For people that want to know how to use their inhaler with a spacer, you can buy one of these at the pharmacy. They're very cheap. There's much smaller ones that just fit this into it. What you want to do is make sure this is well shaken up and works. And I've already tested that before we put it on camera. Put your lips around this area, make a good seal, do a puff, and take a few breaths in and out. And I'll demonstrate this for you now. It's important to take really deep, slow breaths. We don't want to race it in. And if you have the ability to, it's even worth holding on to it for a few seconds before you take your next breath. For some people, you just need 2 puffs, and you can do between 2 to 4 breaths per puff. Some people might need 4, some people might need more. If you're finding you're using your Ventolin inhaler a lot and you're not getting better, it might be time to visit your doctor. Or if you're really worried about it, you have to call an ambulance and make sure that you get your breathing back on track, okay? So everyone take care. Keep your windows closed. Make sure that you're not outside on the really smoky days if you don't need to be. Make sure you got your medication under control. Good luck with the smoke and haze.